Hello, my name's Hannah. How are
Hello.
you?
Good, thank
I'm
you.
going to be your nurse today. I'm going to do some hand hygiene here, putting on some gloves. All right, and can you tell me what your name is?
Jessica George,
Okay, I'm just going to check yours and your date of birth, please.
32375.
All right, I'm going to check that with my information over here. All right, perfect. And do you know where you are today?
Yes, I'm in the hospital.
Do you know what date it is?
February 13th.
Awesome. Okay, and do you have any allergies that I should know about?
No allergies.
Any pain that you're in today?
No pain.
No? All right, wonderful. And you are here for a
Physical assessment for work.
Perfect. All right, so what we're going to do is we're going to do a head-to-toe physical assessment. We are going to start with our cranial nerves, make sure that they're all intact. I'm just going to go ahead and make sure that this bed is level and okay, comfortable to work with. All right, so first of all, we're going to start with cranial nerve number 1. And what I'm going to have you do is I'm going to have you close your eyes. I'm going to have you take in a deep breath and tell me if that you can smell anything. Can you smell anything?
Alcohol?
All right, wonderful. Perfect. So we're going to move on to cranial nerve number 2, 3, 4, and 6 at the same time. We're just going to go ahead and combine them. And I'm going to go ahead and I'm going to start with having you close one of your eyes. And I'm going to have you read the first line and as far down as you can go.
958742843.
Perfect. Now I'm going to have you go ahead and do that with your other eye.
95874284363.
Perfect. All right, wonderful. Now I'm going to go ahead and I'm going to have you cover one of your eyes for me, and I'm going to have you tell me how many fingers you can see that I'm holding.
2.
Okay.
2.
Okay, go ahead and close your other eye.
2. 2.
All right, perfect. Now I'm going to go ahead and have you focus on my nose. Okay, and then I'm going to have you follow my finger. All right, wonderful. I'm going to go ahead and I'm going to shine this light in and make sure the pupils are reacting. Okay, perfect. Perla, wonderful. All right, and now I'm going to go ahead and continue on with cranial nerve number 5, which I'm going to have you go ahead and tell me when you can. I'm going to have you close your eyes and let me know when you can feel any kind of pressure on your face.
Left cheek.
Okay.
Forehead. Right cheek. Chin.
Okay, and go ahead and clench your jaw for me. Perfect. Perfect. Wonderful. Now I'm going to go ahead and I'm going to move on to cranial nerve number 7, which is our facial nerve. I'm going to have you smile for me. Wonderful. Frown. Puff out your cheeks. All right. And then I'm going to have you also close your eyes. And I'm going to put some light pressure on here. I'm going to pull up. Now you put some resistance. All right. Wonderful. Some resistance again. All right. All right. Perfect. And now we're going to go ahead and we're going to do our cranial nerve number 8. Sorry, 8. I'm going to have you close your eyes. I'm going to tell me when you can hear something.
No.
All right. Wonderful.
Yes.
All right. And now we're going to go ahead and we're going to test our cranial nerves number 9, 10, and 12. And I'm going to have you open your mouth for me. All right. I'm going to go ahead and put a tongue depressor back there. Check your gag reflexes. Can you say ah? Can you swallow for me? Can you stick out your tongue? Move it from side to side. All right. Wonderful. And then our last but not least, we're going to do cranial nerve number 11. I'm going to have you shrug your shoulders up. Oh, perfect. All right. Now go ahead and put some resistance. All right. More resistance. All right. Wonderful. It looks like all of our cranial nerves are intact. And thank you so much. And we're going to move on to the rest of our physical assessment here. Okay, Jessica, so at this point of the assessment, we're going to go ahead and we're going to do our vital signs. We're going to go ahead and we're going to take the blood pressure. I'm going to go ahead and put the pulse ox on for you. I'm also going to go ahead and I'm going to count your respirations. And I'm also going to take your temperature. All right, Jessica, so now we're going to start with our head-to-toe assessment. I'm going to go ahead and explain things verbally to you as we go along. I'm just going to start with the top of your head and then work my way down. First of all, I'm just going to go ahead, I'm going to check the scalp, I'm going to check the hair distribution, any bumps, any injuries or anything that I'm not detecting anything. I'm going to go ahead and I'm going to check your skin. Everything looks intact. The color is normal. It's not pale or jaundice or anything like that, so that's good. I'm going to go ahead and I'm just going to check your eyes. We already checked the perla and our cranial nerves. There's no redness in your eye. There's no drainage. There's everything in your face looks symmetrical. There's no facial drooping. I'm going to check your ears. There's no redness, no drainage, nothing abnormal. Do you wear any hearing aids or
No.
anything? No. Okay, perfect. Do you wear glasses or
No.
contacts? Okay, awesome. I'm just going to go ahead. I'm going to check your nose. Everything looks symmetrical. No drainage or anything like that. I'm just going to have you open up your mouth for me. All right. No bleeding of the gums. No sores or lesions, or everything looks moist, pink. So that's always good. Your lips look good. No cracks, no fissures, no anything abnormal. Okay, so I believe I got everything there. I'm just going to go ahead and I'm going to palpate for your lymph nodes. I don't feel anything. If I do feel anything, I would document. All right. I'm going to go ahead. Your trachea looks midline. I'm going to feel for the carotid pulse on each side. I'm checking for jugular vein distension, which you do not have, so that's good. All right. Okay, so also we're going to do a skin assessment. We're going to use a Braden scale to score whether it's a high or a low risk. So it's just kind of like a way for us to determine whether you're at risk for skin breakdown or anything like that. So I've already checked your face. I'm going to go ahead and I'm going to check your arms. I'm looking for cyanotic or bruising or anything. I'm just going to go ahead and check your legs. I'm just going to check your skin everywhere, so that's good. I'm going to check the temperature with the back of my hand, the dorsal part, for it, whether it's cool, clammy, or warm or anything. Everything feels fine. All right. Okay, perfect. I'm going to go ahead and I'm going to test the tenting, the skin turgor, which indicates whether you're hydrated or not, which yours is good. All right, I believe that is everything in that. Let's go ahead and check your capillary refills as well. Okay, I'm going to go ahead and check your toes while we're at it. Okay, everything's good. All right, I'm going to go ahead and move. All right, so the next part of our assessment, we're going to go ahead and I'm just going to test the strength in your shoulders, and then I'm going to see if they're symmetrical in your arms. We're going to check for any IV sites, which you don't clearly have, bruising, temperature, which we already did. Check your range of motion. Can you go ahead, lift your arms up, down, down. Do you have any problems when you're doing your daily activities, ADLs or anything? No, you're good? All right, perfect. So then we're going to go ahead and we're also going to check for the radial pulses. Okay, bilaterally. I'm going to go ahead down on your feet. I'm going to check your dorsal pulses, which are on the top of your feet, and then your posterior tibial pulses back here. Also your popliteal, which are right behind your knees. All right, I believe that's everything for the pulses. All right, so we're going to continue on with our head-to-toe assessment. I'm just going to check the strength in your hands. You can just squeeze my hands as hard as you can. Okay, perfect, good. I forgot to ask you really quickly in your joints, was there any stiffness or any no swollen? All right, perfect. All right, moving on, I'm going to go ahead and I'm going to assess your thoracic cavity. Do you have any surgery scars?
No.
Or, okay, everything looks symmetrical. I'm going to go ahead and I'm going to auscultate your heart sounds and then also your lung sounds in front. All right, so we're going to listen to your heart, and then here we're going to start with the aortic, pulmonic, continue on to the Erb's point, tricuspid, and then the apical. All right, and then we're going to go ahead and we're going to move on to the lung sounds in the front. When you feel my stethoscope hit your skin, just go ahead and take a deep breath for me. All right, perfect. Now I'm just going to go ahead and ask you a few questions. Do you use tobacco at all?
No.
Do you drink?
No.
Do you have a cough, a persistent cough or anything that's been going on? Any sputum or anything?
No.
Okay, all right. All right. Now we're going to go ahead and assess your back. we're just going to listen to the lung sounds here in the back. So like I said before, just take a deep breath. Alright, so I've listened to all 8 points on the back of your lungs. I'm going to go ahead and assess your back for any moles, overall condition, any scars, anything like that. I'm going to go ahead and I'm going to check your coccyx for any edema or anything abnormal. Everything looks good. Alright. Alright, so we're going to have you laying back for this part of the head to toe assessment. I'm just going to go ahead and I'm going to assess your abdomen area. First of all, I'm just going to go ahead, I'm going to look for any bruising, any distension, any bulges, any masses, any drains or tubes or anything that might be going on, which clearly you have none of those. I'm also going to have to ask you when the last time that you went to the bathroom was.
This morning.
Okay, is that like a normal?
Yes.
Normal? Okay, perfect. Have you been having any nausea, any vomiting,
No.
any problems eating or anything?
No.
All right, awesome. Good to hear. I'm going to go ahead and now I'm just going to auscultate your abdomen. I'm going to auscultate in all 4 quadrants. I'm going to start in the right lower quadrant. And then I'm going to start on the other one. I'm going to do all 4. And what I'm assessing for is I'm assessing for either hyper, hypo, or normal. If I don't hear any sounds at all in any of them, I'm going to go ahead and listen for 5 minutes in each quadrant just to make sure. Alright, everything sounds good. Now I'm just going to palpate. If you can just let me know if there's any pain. Okay, I'm going to do that in all 4 quadrants as well. Alright, perfect. Just a couple more questions. When you are urinating or anything, do you see any blood, any discoloration, any dark, anything abnormal?
No.
Alright, sounds good. Alright, so we're going to go ahead and we're going to continue on to the lower extremities, our legs. What I'm going to be doing is I'm going to be assessing for symmetry. Do you have any stiffness or any pain or any swelling in your hips areas or anything? Alright, do you use any like a walker cane, any mobile devices? Alright, so I'm going to go ahead, I'm going to assess for temperature, the skin breakdown, hair distribution. I'm going to check for pretibular edema. None, that's good. I'm checking your feet. We already checked the pulses on the feet, the pedal and the posterior tibial. I'm checking for temperature, bruising, anything like that. I'm checking for bony prominences on the feet to make sure there's no skin breakdown, anything like that. I'm going to go ahead and I'm going to have you push against my feet for muscle strength. All right, good. And then I'm also going to go ahead and I'm going to check the Hohmann sign, which I'm going to have you pull your toes toward you, and if you feel any pain in your calves.
No.
All right? That is contradictory for patients with DVT, so that's always something to be careful about. I'm going to check for redness, swelling. You said there was no pain. All right, so also I'm going to go ahead and I'm going to have you come down for just a second. I'm going to go ahead. I'm going to assess your gait. I'm going to have you walk right over there, away from me. I'm checking hip symmetry, everything. I'm going to have you walk back towards me. All right, and one more time. All right, just to make sure. Everything looks good. Your gait looks fine. You said there's no canes, walkers, any mobile devices. You can go ahead and sit back down there if you'd like. All right, so one more thing that I'm going to ask you to do. We're going to do the Ryan and Weber test. So when I go ahead, I'm going to put it behind your ear. As soon as you stop hearing the tingling or the zinging sound, just let me know, okay? Right behind your ear at the mastoid.
Okay.
Okay. All right, I'm going to do it on this side.
Okay.
All right, perfect. I'm going to go ahead. I'm going to do it on the top of your head.
Okay.
All right, perfect. I am also going to ask you a few questions regarding abuse or anything like that. Do you feel safe here now?
Yes.
Do you feel safe at home?
No.
All right. Anything you want to tell me or talk to me about or
No.
let anyone know about? All right, cool, awesome. We're going to do a fall risk and a plan for like activities. Can you go to the bathroom by yourself?
Yes.
All right, perfect. I believe we already covered that anyway. All right, so moving on, we're going to go ahead and do a test called a Romberg test. So what I'm going to have you do is I'm going to have you come and stand again in front of me. I'm going to have you close your eyes and put out your arms for balance, and then lift up one of your legs and hold it there for a few seconds. Yeah. Perfect. And then on the other side. All right, perfect. And that's just like to assess your balance and stuff like that. All right, and for the very end, I promise it's almost over. We're going to go ahead, we're going to check your deep tendon reflexes. I'm just going to go like this. Just go ahead and relax. All right, perfect. Good. Do the other side. All right. Everything's in order. All right, so we're almost done. I just wanted to let you know that during this whole process, we made sure for safety, made sure everything was okay, we made sure the bed was at an appropriate height, we made sure all the safety rails were up, we washed hands per CDC protocol. Also, I just want to let you know that if you need us, go ahead and the call light here is in reach. Just go ahead and press that button if you need us. And yeah, that was everything was wonderful. Do you have any other questions before I go or
No.
anything?
Thank you.
All right, wonderful. All right, thanks so much, Jessica. I gotta go. I'm gonna go document everything that happened and took place today, and I hope you have a wonderful rest of your day.
Thank you.
Come visit us again soon.
Thank you.
All right, have a good one.